Hey y'all, welcome back to a brand new episode of Crown Talks. It's Dr. Reagan, and I got a really good episode for you today. We're going to talk about something that we don't really talk about enough: oral health. So, your smile says a lot, but not just about your appearance. Oral health affects everything from your heart to your self esteem. Did you know that 53 million people live with untreated tooth decay? 25% of adults aged 65 and older have lost all their teeth due to untreated oral disease. Can you imagine what that does to your nutrition and your ability to chew? And only one in five school age children from low income families receive dental sealants to prevent dental caries. So, today we're digging into what our mouths can tell us about our overall health. Dr. Camille Tabor-Cobb is a dentist with her own mobile practice, y'all, in Memphis and Mississippi. She's here to help us get these grills together. Uh, these grills. Welcome, Dr. Tabor-Cobb.
Hi, thank you, Reagan, for having me today.
Yeah. Okay, let's jump straight into it. What is one myth about dental care that you want to bust right now?
Oh my gosh. I would say the top one is my baby took all my calcium out my teeth.
Mm, okay, tell us about that.
Well, I'm not sure where the myth came from, but we try to explain to patients that, when you're going through pregnancy, your body is in overdrive. You're trying to support another human being. So everything intensifies. So if you're not meticulous with your hygiene, such as plaque removal, flossing, even using some mouthwash, you're more susceptible to gingivitis. And
Mm,
then those cravings that we normally crave sweets. So you actually increase the amount of sweets and carbs or even soda and juice that you eat. So you're more susceptible to having more dental issues than you would if you were not pregnant.
okay, that makes perfect sense. So, why do you think, or why is oral health such an important part of our overall health?
Well, I mean, it's important because you can think about it. The mouth is the gateway to the rest of your body. I
Mhm.
mean, if you have infection, inflammation, even bacteria in your mouth, which can be some of the most deadliest bacteria that we have in our body, it gets into leave your mouth and it actually spreads to your bloodstream and go to other organs. And that's why so many doctors and dentists are now following what you want to call whole health models where we take care of not only the mouth, but we take care of the rest of the body because it's all connected.
Right, right. And I know a lot, like I just got through doing a class with students where I was teaching them suturing. And one of the things we always teach them is you can't sew up a human bite because the mouth has so much bacteria. You sew it up and then people end up with a nasty infection.
That's true.
Um, So, like you just said, a lot of people don't know that oral health can affect things like heart disease and diabetes, and that connection is really real. What other health issues can be impacted?
The biggest thing, I try to explain to patients, everybody seems to want to focus on the cavity part of it, but the gum disease part of it, they're not aware of it, is the one that probably causes the most issues. And it's mainly because, I mean, gum disease is inflammation that starts in the mouth and goes to the rest of the body. But it puts you at risk for increased heart disease, strokes. If you have diabetes, it makes it harder to manage your blood sugar and also dementia. So the inflammation going through the bloodstream into the brain can kill the cells slowly and put you at risk for dementia at earlier ages these times, as well as erectile dysfunction and infertility for women and men.
Oh, wow. Yeah, that's huge. I know a lot of people don't know about that.
Oh yeah, that's one of the big ones that I try to push, especially for the African American community. And I know those things are important when you're trying to bring life into the world and not understanding that if your mouth is not well, the rest of you is not.
hmm Now, many people avoid the dentist for a lot of reasons, maybe fear, cost, of course, you just said low income communities. Or some people even like because of the cost, they may choose to have a tooth pulled versus trying to come up with the expense of trying to save a tooth or something like that. How do you help patients overcome those barriers of fear and cost?
Well, one, for my practice being mobile, I meet them where they are. When I'm having a conversation with patients and, they give me all the list of things that, they feel were the cause for their health, I tell them today is your new start. I mean, honestly, I'm here to educate you and get you the care you need to get you to a healthier you. So, when I'm talking to them and, they tell me that they have fear, one thing that I do focus on, I make sure that we have trauma informed and patient centered approach. So that means for me, I explain every step, I move slowly. I may even pray with my patients and over them before the procedure just to, build that trust and make them feel a little better. I understand that people have fear, whether it's from experiences that others have or their own experience, that they even hearing things, how social media kind of changed the outlook of how dentistry looks. I mean, if you take the preventive approach and actually go see your dentist more frequently, we could catch things before they become costly, because the longer you wait, the more it costs. And also one thing that a lot of offices are starting to introduce, as well as my own, we have membership plans for people who may need a little more help as far as costs go, where it's like a monthly cost depending on the health of your mouth at the time that you join. And also we have finances available, but you have to ask to know if those things are available to you at the practice you choose.
Right. Don't just assume you can't afford. Like, you can
Right,
reach out and ask the
right.
question, and you might
Yes.
be surprised what you find.
Amen.
So, how early should parents start caring for their children's teeth? And what might be a red flag that they might miss?
Well, I tell parents that, you actually need to start before teeth actually come in the mouth. Actually presenting a cloth where you wipe the gums down after they have a bottle will actually get them comfortable with someone or even something being in their mouth. So I would say starting as soon before teeth come into their mouth. One thing is once the teeth start, you brush with a small rice size amount of toothpaste to actually introduce the toothbrush into the kid's mouth. And then secondly, you have to reduce the amount of sweets and snacking, juice, milk, especially laying them down with these things in the bottle, because juvenile tooth decay is actually rampant in the community at this time. And we keep seeing stories about children going to the hospital to get care under anesthesia. Some of them lose their lives due to the anesthesia. Well, children wouldn't have to be in that type of predicament if we're actually focusing on hygiene really early, because the earlier you start, the more likely they would keep those habits into adulthood.
Yeah.
Some of the red flags, I would say white and brown spots on the teeth can be some that, that you can see visually. If your child is still drinking on a bottle and they have a mouth full of teeth, you're already increasing that risk of tooth decay. If your teeth are not coming in at the appropriate time, children's teeth usually come in around 6 months. So if your baby is 12 months or more and has not had one tooth come in, or even just still hanging on to 2 or 4, that's a good time to introduce the dentist into the mix, so that the children not only get comfortable with the dentist, but then for you to find out if anything else is causing that delay. So that's what I would say most of the top red flags would be.
Yeah, that's awesome. And I was not aware, that people having to get in for anesthesia and end up, having complications. You don't think about the complications of anesthesia with having to have
Right.
this done
Especially at
when
a
you
young age.
prevent it.
Yeah,
Yeah.
you're right.
All right. So we know access to dental care isn't equal in, like everything else in healthcare. Especially when insurances don't believe that your mouth is a part of the body. You have to have a separate insurance for
Right.
your teeth, but even more, especially in Black and rural communities. So that's why I'm super, super excited to talk to you today about, and you have a mobile service which really aims to kind of fix that, right? You're able to provide services to communities that don't typically get service.
Correct. So, when I started this business, one, I have 3 barriers that I feel are top for our communities, but I'm able to help with 2. And one of them is, providing service that come to them, because a lot of these communities do not have transportation for you to get to the dentist, or there's no dentist in their community at all. And they
Right.
have to drive as far as 30 miles just to get to one. And also, I'm big on education and prevention of oral cavity diseases and conditions. So helping communities to really understand the importance of their mouth early, it will solve a lot of these issues long term.
Yeah, I'm so proud of you and the work that you're doing. It's
Thank
so
you.
super, super exciting to see that you're in not just Memphis, but in, I guess, what, northern Mississippi too.
Yes, I
Yeah.
actually go down. I have a patient that's in southern Mississippi near the Louisiana border.
Oh wow.
Right. It depends. I usually go where I'm needed. If
Yeah.
my heart is actually singing to me, I'll take that drive. And that patient is about 4.5 hours one way.
Wow. Awesome, y'all. Y'all, we're gonna give her contact information. So if you're in need of care, we can get you connected. All right. So back to adults. So what are some other signs that oral health might be affecting the rest of the body?
I mean, one of the top ones is bleeding and swollen gums.
Hmm.
If your gums are bleeding, it's a reason why it's bleeding. And you really need to get to someone to see why it's bleeding, because that's not normal. Also, having bad breath that just won't go away, loose teeth is another big one. Dry mouth is very big, because usually a lot of the medications, especially medications for heart, high blood pressure, can cause dry mouth. So dry mouth is one. If you have chronic headaches or neck pain, it can actually be coming from your mouth as well. Controlling their diabetes and any signs of infections at all would be the top things.
Yeah, yeah, she learned to me today too. So I hope y'all listen. All
Oh,
right.
and can I add one more thing? I was going to say, if you're having airway issues, it can be also one of the things could be coming from a problem of your mouth as well.
Yeah, like difficulty breathing.
Yes, difficulty breathing. Those people on CPAP, you may
Hmm.
want to go see a dental specialist that treats the airway, because you'll
Wow.
be surprised how simple the fix is, and you can get rid of that machine.
Oh wow. Yeah, y'all need to hear that because from experience, I know folks hate that CPAP machine
Oh yeah,
when
and
I'm
it
trying to
drives your mouth
prescribe
out.
one. So if you
Yeah.
don't want to be on CPAP, let's make sure we're checking out your oral health too. All right. All right. Now you know that one side too, folks be pretending like ain't missing. All right, what's really going on and when we lose a tooth there? And how can that be dangerous not being able to replace that tooth?
Well, the biggest issue is all of our teeth in our mouth has a job to do.
Mhm.
And when you start taking any of them out, whether it's due to cost or fear of the dentist or just not taking care of yourself, it can cause a domino effect of other things going on. So when you lose a tooth, other teeth start shifting. So they're not able to play their role as effective as they would if that tooth was there. Like our back jaw teeth, they all have 2 and 3 roots. So all the forces are concentrated there. So when you lose any of those teeth or all those same forces have to be put on single root teeth, which are your front teeth. And that's why you see people with either the side tooth smile, or either the teeth start spreading and getting gaps, or even if they look, I hate to say this, but the appearance of a horse. So they stick out a little further than your mouth, or even look really long, because teeth want to go into that space where that tooth is missing.
Mm-hmm.
The thing is, when you start losing teeth, it not only affect the teeth that are there, but the bone in the area where the teeth come from will actually shrink. So if down the road you are needing dentures or partial, you won't have enough structure to support those things. So if you're doing this young and you need dentures, so you may need dentures, let's say at 30, by 80, your dentures are no longer going to fit, and you're not going to be able to get any additional set, because it's nothing supporting it anymore. Teeth supports the bone, and all this affects your face shape. It affects the way you bite, and it also can affect your speech and the way you digest food.
Okay, that was heavy because I had to have some teeth removed from the back, and that's what happened. Like the top teeth dropped down. So when I went to get
Mhm.
implants, it was like you waited too late. So anyway, long story.
But it's true.
Just
Yeah.
say I'm
That's
a witness,
a good
okay?
example. Good example.
Yes. All right. So another thing we don't talk about enough, we talk about this side too, but what we don't talk about enough is the tongue. But it tells a story too about our health. So what should people know about tongue health and how do we keep it healthy?
Well, just like you would take care of your teeth, brushing and flossing daily, as we should. One thing I always recommend to my patients, because the tongue can hold so much food, it can hold bacteria, it also can hold odor. Those who are smokers, their tongue actually changes where the taste buds, which are usually round and bumpy, will start getting a hair-like appearance. And the hair-like appearance over time will stain with food or even from the smoke, the nicotine that's in the cigarettes. So then it looks like what we call hairy tongue. You should definitely look that up. You'll see some cool examples. But the smell coming from the tongue, you want to keep a clean mouth at all times. So I'm going to show you an instrument that I use a lot. This right here is a stainless steel tongue scraper. This is magic to your mouth. And then it also, once you use it to actually scrape the stuff away from your tongue like this, you will be able to not only have a fresher tasting mouth, but fresher breath, and you'll be able to taste your food a lot better. So tongue scraping is just as important as brushing and flossing.
So do you scrape the tongue every time you brush your teeth or like once
I
twice a
scrape
week?
it every single time I brush my teeth. And if I eat something that is a little, like you have food that are strong, like onions and garlic,
Mm-hmm.
I'll sneak away and actually use it to scrape.
Okay.
Because it's like I said, it holds those odors, and then people wonder why they have a smell emanating from their mouth. And
Yeah.
sometimes the culprit, if it's not the digestive system, it's that tongue.
All right. Y'all heard it. Get you a tongue scraper. I'm sure they have some. I bought one, I think, from Amazon. Okay. This is not a advertisement for Amazon unless y'all want to pay me. All right. Now let's have some fun. Rapid fire round. What's a toothpaste flavor you can't stand?
Cinnamon. Ugh, cinnamon. Close up needs to go away.
But close up is inexpensive, and I think that's why it's stuck around so long. Okay. Brushing or flossing, which one do people often skip more?
Flossing, because it's
Mhm.
not a habit, and they do not know how to properly use the string. But it's okay to use those plackers.
Okay. Okay. That's good. Those are easier for me too. Anyway, soft or hard toothbrush?
Soft, of course. Do less
Electric or
damage.
manual?
Manual is fine, but getting electric is even better.
Okay. What's the bigger villain, candy or soda?
I would say probably the soda, because we tend to hold on to it for a long time. The candy we usually eat and it's gone, but usually a soda, we're usually sipping on it a long time. So that means the mouth stays in acidic range for
Yeah.
too long and causes enamel breakdown.
Yeah. And what's your one wish for the future of oral health?
Well, number one is access to care just being so much better, that everybody, it be a right for everybody instead of
Yeah.
just a privilege.
Yeah. All right. Dr. Camille, thank you so much for joining us today. Really, really great information on oral health and how oral health is really our self care, too, right? It's
It
like how we
is. It
look, but
is.
it's so important to how we eat, how it impacts so many other aspects of our bodies, which the dementia thing threw me, but that's, yeah. But anyway, so your oral health is about your confidence. So we need prevention and access all in one for sure. Um, this has been your crown check with Crown Talks. Like, subscribe, and share. And we'll see you next time. We out.